In a modern hospital, sedation is precise, measured, and carefully monitored. An anesthesiologist calculates dosages down to the milligram. Machines track oxygen levels and heart rhythms, and patients drift into controlled unconsciousness, often awakening with no memory of the procedure at all. Pain, once feared as inevitable, has become something medicine actively prevents. But for most of human history, pain was not an unfortunate side effect of medical treatment. It was an expected companion. In medieval Europe, long before anesthesiology existed as a discipline, surgeons, barbers, monks, and healers faced a grim problem. How do you cut into a living body without killing the patient from shock, terror, or agony? The answer was not elegant, not reliable, and often not humane by modern standards. Yet it was not entirely ignorant either. Medieval practitioners developed a strange, improvised science of sedation, a blend of herbal knowledge, trial and error, religious belief, and sheer necessity. This is the story of how medieval people tried to escape pain when true anesthesia was still centuries away. Pain as a natural order. To understand medieval sedation, we must first understand how medieval people thought about pain itself. Pain was not always seen as something to be eliminated. In Christian Europe, suffering was deeply entangled with theology. Pain could be punishment for sin, a test of faith, or even a path to spiritual purification. Christ's suffering on the cross was central to Christian identity, and enduring pain with patience was often seen as virtuous. This did not mean medieval people welcomed pain, far from it. They feared it intensely, but they often accepted it as inevitable. Medicine, therefore, did not always aim to abolish pain completely. Instead, it sought to reduce, distract, or shorten it. Sedation was less about rendering a patient unconscious and more about making the unbearable barely survivable. The limits of medieval surgery. Medieval surgery was brutal not because surgeons were cruel, but because they had no alternative. Without antibiotics, even a small infection could be fatal. Without blood transfusions, excessive bleeding meant death. Without anesthesia, surgery had to be fast. Speed was the surgeon's greatest skill. Amputations were measured in seconds. Surgeons prided themselves on how quickly they could remove a limb. The longer a patient screamed, struggled, or went into shock, the lower their chances of survival. Sedation, therefore, was not about comfort alone. It was about control. Alcohol, humanity's oldest anesthetic. The most common form of medieval sedation was also the simplest. Alcohol, wine, beer, and spirits were readily available, socially accepted, and known to dull pain. Patients were often instructed to drink heavily before surgery. In some cases, they were forcibly made to drink until they were incoherent. Strong wine was especially favored in southern Europe, while ale or mead was more common in the north. Alcohol served several purposes at once. It numbed pain, reduced anxiety, and made patients easier to restrain. But alcohol had severe limitations. Its effects were unpredictable. Some patients became aggressive rather than sedated. Others vomited or lost consciousness too deeply, risking suffocation. Still, for centuries, alcohol remained the most reliable anesthetic medicine had. Herbal knowledge and dangerous plants. Beyond alcohol, medieval practitioners turned to plants, some helpful, some deadly. Opium and poppies. Opium, derived from the poppy, was known in Europe through ancient Greek and Islamic medical texts. It was recognized for its pain-relieving and sleep-inducing properties. However, opium was expensive, difficult to dose accurately, and potentially lethal. Too little did nothing. too much stopped breathing. As a result, it was often reserved for elite patients or mixed into complex herbal preparations to dilute its strength. Mandrake, the screaming root. Few plants are as famous or infamous as mandrake. Mandrake root contains compounds that can induce sleep, confusion, and unconsciousness. Medieval texts describe its use as a sedative for surgery, often soaked in wine. Mandrake also inspired terrifying folklore. It was believed to scream when pulled from the ground, killing anyone who heard it. Elaborate rituals were invented to harvest it safely, including tying it to a dog and running away. While the myths were exaggerated, the danger was real. Mandrake could cause hallucinations, respiratory failure, or death if misused. Henbane and nightshade. Henbane and deadly nightshade, belladonna, were also used in sedative mixtures. These plants affected the nervous system, sometimes producing deep unconsciousness. They were powerful and wildly unpredictable. A patient might fall into a deep sleep, or they might convulse, hallucinate, or never wake up at all. Sedation was always a gamble. The soporific sponge. One of the most intriguing medieval sedative devices was the soporific sponge. Medical texts from the Middle Ages describe sponges soaked in a mixture of opium, mandrake, henbane, hemlock, and wine. The sponge would be dried and stored. Before surgery, it was moistened and held under the patient's nose so they inhaled the fumes. This was, in theory, an early form of inhalational anesthesia. In practice, it was wildly inconsistent. Different plants released different compounds when heated or moistened. Dosage was impossible to control. Some patients became lightly sedated. Others lost consciousness completely. Some stopped breathing. Yet the idea itself was remarkably advanced, inducing sleep through inhalation rather than ingestion. Physical restraint and shock. When chemical sedation failed or was unavailable, physical methods filled the gap. Patients were restrained with ropes, held down by assistants, or immobilized in chairs. Biting sticks or leather straps were placed between the teeth to prevent tongue injuries. In some cases, surgeons relied on shock itself as a sedative. A sudden incision could overwhelm the nervous system, causing fainting. This was dangerous, but sometimes effective. Pain-induced unconsciousness, however, carried a high risk of death. Prayer, faith, and psychological sedation. Medieval sedation was not purely physical. Psychological and spiritual techniques played a significant role. Patients prayed before surgery. Clergy were often present. The belief that suffering had meaning could, in some cases, help patients endure it. Surgeons also used reassurance, ritual, and familiarity. Being treated by a known barber surgeon in one's own town was less terrifying than being handled by a stranger. Fear itself could kill. Anything that reduced terror, faith, ritual, trust, was a form of sedation. Cultural differences in sedation. Sedative practices varied across cultures. In the Islamic world, medical knowledge was more advanced in many respects. Physicians such as Avicenna described sedative compounds and emphasized careful observation. Opium use was more systematic, though still dangerous. In East Asia, herbal medicine developed along different lines, focusing more on balancing bodily energies than inducing unconsciousness. True surgical sedation remained rare. Medieval Europe sat at an intersection of inherited classical knowledge, folk medicine, and religious worldview. Its sedation practices reflected that mixture. The moral debate over pain. Not everyone believed pain should be reduced. Some theologians argued that pain during surgery was morally appropriate. Removing pain, they claimed, interfered with divine will, or robbed suffering of its spiritual value. Others countered that unnecessary suffering was cruel and unchristian. These debates echo faintly in modern discussions about end-of-life care and pain management. Why medieval sedation never truly worked. Despite centuries of experimentation, medieval sedation never achieved reliability. The reasons were structural. No understanding of dosage, no knowledge of respiratory physiology, no sterile conditions, no monitoring of vital signs. Sedation was always approximate, always dangerous, always secondary to speed. True anesthesia required chemistry, physiology, and controlled experimentation, tools that would not fully arrive until the 19th century. The turning point, early modern medicine. By the Renaissance, anatomical study advanced rapidly. Surgeons began to understand the body as a system rather than a mystery. Yet pain remained unsolved. It was not until the discovery of ether and chloroform in the 1800s that surgery truly changed. For the first time, patients could be rendered unconscious safely and predictably. The screams that had defined surgery for thousands of years fell silent. Remembering the strange science. Looking back, medieval sedation seems horrifying, and it often was, but it was also an earnest attempt to solve an impossible problem with limited tools. Medieval practitioners were not ignorant brutes. They were working at the edge of human knowledge, balancing danger against necessity. They experimented, they observed, they learned, slowly, painfully, imperfectly. Their strange science reminds us that modern medicine is not inevitable. It is built on centuries of failure, courage, and improvisation. A sleepy historian's closing thought. Imagine lying on a wooden table, surrounded by candlelight. The air smells of wine, herbs, and fear. A sponge is placed under your nose. A prayer is whispered. Hands grip your arms. You do not know if you will wake. In that moment, medieval sedation was not science or superstition. It was hope, and hope, even when crude, has always been part of medicine's story.